I've been in chronic pain for probably 17 years. And it's gotten progressive to the place where I haven't been able to work effectively, see patients without running way behind. At the end of the day, walking out of the office, I'm basically shuffling, and my right side, my right hip was collapsing. The diagnostics that we've done showed that I have bilateral degeneration of the hips, low back, right shoulder, and in my neck. I've actually lost about 2 inches in height from the disc spaces beginning to deteriorate. Bone substances in the spine were stable. Before I came down, we ran some blood work because it didn't make any sense. I've stayed in excellent physical condition my entire life, and I eat extremely well. So with your encouragement and some of the things that we did, I ran Lyme patterns, and I ran Epstein-Barr virus. I ran a whole panel immunological indicators. You know, I've been treated, as you know, for 3 weeks every day, and we were doing 10 pass ozone and laser. We've utilized exosome, both IV and injected into the hips. It was bone marrow and PRP mixed together.
Yeah.
We've done IV silver. You've got me on a host of nutrition and so forth, and that's been on a day-to-day basis continually since I've been here.
Yeah, and don't forget about the CVAC.
Oh, I forgot. Yeah, the CVAC. That's an interesting piece of training equipment, which is high and low pressure altitude training, and dramatically increasing the body's capacity to handle workload.
What have been the results?
Well, the results, and by the way, you also did some specific cranial work with me, which was extraordinary. All this, just as an ad, all this started with major injuries to my body, and I've been stalwart enough to be able to limp through it. I've had great care. We have a clinic up north that my guys are really top shelf in what they do, from acupuncture to applied kinesiology and so forth, but the piece that was missing was, and nothing was holding, it was because of the microorganisms. But when I came down, my right leg was not stable. I couldn't stand, I couldn't walk, I couldn't lift anything. And I'm able to walk, and that's just in 3 weeks. I'm not fearful of going back into the office next week, where I was thinking seriously that I was going to have to retire.
Yeah.
But I am super excited. I'm over the top happy with the results and the things that you do. The work that you do is extraordinary, and I appreciate it.
Yeah, thanks. So if there was someone that was kind of in pain, in chronic pain, maybe is not getting the answers that they want, they've tried a lot of different things, maybe even stem cells
Which I did.
office. You did, yeah. What would be like kind of just the synopsis of, you know, what advice would you give someone that was watching this?
Well, you know, it's interesting, Dr. John, because when I treat patients, I do all the things I did do for myself, and we kiddingly said, you know, the doctor who treats himself as a fool for the patient. But you've got to do everything. You've got to do all the biochemical testing. You have to integrate all the different pieces, from the work that you do neurologically to the intervention that you do with killing the microorganisms. I mean, you have an insight, a capacity that 99% of the docs out there don't have. And so you have to do it in specifics. You've got to look at dietary patterns. You've got to look at rehabilitation after the fact, but you've got to handle whatever's inside the body. And then, you know, it's that structural, chemical, emotional triad that we look at and support. You can't just pick one side and do it. You've got to do it all. And for me, the missing link was the biochemical pieces from the microorganism standpoint of view, and the injuries to my head. And you know, that was the straw that broke the camel's back for me, and just let everything kind of fall apart.
It's like a perfect storm.
Perfect storm.
Yeah, and it is confusing when you're a practitioner. You know, I was in the same boat that you were. You know, had chronic Lyme disease, and I was searching, and nobody ran the right tests on me. And when I finally figured out what was wrong with me, I traveled to Europe a couple of times, and I went to a lot of practitioners, and no one really even seemed to have all of the right answers all at one place. So I think, you know, what my friend Dan Pompa always says, from pain to purpose.
Yes.
You know,
Absolutely.
So now we both have a good pain to purpose story.
We have another door so we can help many other people.
Yeah.
But this was eye-opening, and I can't thank you enough. I appreciate it.
You're very welcome.
For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.